Education 1. Letter A. Medical education in the UK. Medical education in the UK covers undergraduate education for for our HIV for our 5 years at medical school, the section of a university responsible for medical education, a 2 year foundation program which provides training for new doctors after graduation through a series of placements in different specialties. See Unit 12. Postgraduate training which doctors take to become GPS or consultants, senior specialists, often delivered college for different specialized specialties. For example, the Royal College of Physicians, continuing professional development in the form of course and seminars which doctors undertake throughout their working lives to keep up to date. Letter B. Extract from an undergraduate prospectus. The ABCHB, Bachelor of Medicine, Bachelor of Surgery, is a 5-year undergraduate medical degree course. Most of your learning takes place in small groups. The main components are core, years 1, 3, and integrated program for clinical and scientific topics mainly present through problem-based learning PBL. Will you work with others on the series of case problems? Students selected models. Student selected models SAMS allow you to choose from a menu of subjects such as sports medicine or even study a language as preparation for an overseas elective and hospital attachment of your own choice between years 4 and 5. Vocational studies and clinical skills. This component prepares you for the clinical skill required for contact with patients for year 1 of your course through periods of practical training where you are attached to a hospital department or general practice. Clinical attachments, years 4 and 5. A series of 4-week clinical attachments in medicine, surgery, psychological medicine, child health, obstetrics and gynecology, and general practice. Letter C, a student view. L, a medical student describes her course. I'm just finishing my first year of medicine. What is like about this course is that your involvement with patients from the very begins. Even in our first year, we spend time in hospital. Much of the course is PBL. We have 2-hour sessions a week where we work in groups of 8 to 10 solving clinical problems. We decide together how to take the problem, look up books and online sources, make notes, and discuss the case together. It's a great way of learning and getting to know to other students. In the past, medical students had lectures with the whole class taking notes from lectures from 9 to 5, but now it's mainly groups work, although we do have some lectures and seminars where we were in small groups with a tutor. I like all of it. Even to the sections, we get to cut up cadavers from the second month of the course. Exercise 11.1. Match activities to stage of medical education in the UK given in A opposite. 1. Dissecting cadavers undergraduate. 2. Keeping a log of surgical procedures, observe and perform postgraduate. 3. Working for 4 months in accident and emergency to experience this specialty foundation program. 4. Taking a 4-week attachment in obstetrics and gynecology undergraduate. 5. Taking an online course on recent developments in cardiovascular continuing professional development. Exercise 11.2. Complete the sentence. Look at B and C opposite to help you. 1. Just before their final year, students have the chance to take elective in a hospital of their choice anywhere in the world. 2. Problem-based learning. Contracts which an approach where each subject is shown separately. 3. Today's lectures are often interactive, with regular opportunities for the student for ask questions. 4. In clinical attachment, students learn how to treat and manage patients. 5. Students selected modules can be a topic for outside medicine, such as foreign language. 6. Dissection of cadavers is an important part of the anatomy component. 7. The medical school at the University of Edinburgh is one of the oldest in the UK. 8. She is a consultant in the Royal, one of the leading pediatric hair specialists in the country. 9. The Royal College of Surgeons in Edinburgh date from 1505. 10. We have a similar each week where we discuss topics in a small group with our lecture. Exercise 11.3. Match each of these activities to one of the components of the undergraduate course described in B and C opposite. 1. Julie spent 6 weeks working in a small hospital in the Himalayas, overseas elective. 2. A group of Students discuss together the possible reason for abdominal pain after meal in a obvious 44 years of male problem-based learning PBL. 3. A small group of students trace the pulmonary artery in cadaver dissection. 4. Auto spends a month working in the pediatric ward of the local hospital. Clinical attachment. 5. And learns how to take blood from an elderly patient. Clinical skills. 6. Chuma chooses to study travel medicine in his fourth year. Student selected module. Thank you.